Okay, if you're a parent, you know this struggle. The whole potty training marathon, you think you've crossed the finish line, and then an accident. It's so frustrating, right? It can make you feel like you're missing something. But here's the thing. What if it's not about what you're doing wrong at all? So let's just ask the big question right up front. Why does this happen so much, even with kids who totally seem to have it figured out? It's the kind of thing that can drive you crazy, but in this explainer, we are going to get to the bottom of it. First things first, let's just put this into perspective. If you're dealing with bedwetting, you are so not alone. A full 20% of all 5-year-olds wet the bed. Think about that. That's 1 in every 5 kids at a birthday party. This isn't some rare problem. It's a super common part of growing up. And this is the big mindset shift we need to make. For a whole lot of kids, this is not a choice. It's not them being lazy or defiant. It's all about some super complex biology, a system that's literally still being built inside their little bodies. All right, so to really get what's happening, we gotta take a quick look under the hood at the body's plumbing system and its main control room. I promise we'll keep it simple. Just think of it like this, okay? The brain is the command center, calling all the shots. The bladder, well, that's the reservoir, holding everything. And the nerves, that's all the wiring connecting the two. And for this whole system to work, all 3 parts have to be talking to each other perfectly. And what's so fascinating is how this all comes online over time. For a baby, peeing is just an automatic reflex, no thought involved. Then, as a toddler, they start to get that, uh-oh, I have to go feeling. But it's not until they're older that they get that real fine-tuning down. See? It's a whole learning process, not like flipping a switch. Okay, so on a good day, here's how it's supposed to go down. 1, the bladder fills up. 2, it sends a little message up the wiring to the brain saying, hey, getting full down here. 3, the brain's command center gives the go signal. And 4, the bladder squeezes, the gates open up, and everything empties out. Sounds simple, right? But it's actually this incredible, perfectly timed dance. But what happens when that perfect dance gets, well, a little clumsy? What happens when the signals start getting crossed? Right, so there's a name for this. It's called dysfunctional voiding. And that name really says it all. It's a coordination problem. The bladder's trying to squeeze, but the muscle that's supposed to open is staying shut. And the key thing to remember is that this happens in kids who are completely healthy otherwise. So what are you actually seeing at home? Well, it could be a bunch of things. Maybe they're getting a lot of UTIs. Or maybe you'll notice they only use the bathroom like 2 or 3 times a day, which is not a lot. And of course, the big ones are daytime accidents and bedwetting. It can even be connected to pooping problems too. All right, I really want you to listen to this. If you remember one single thing from our chat today, make it this. The #1 enemy of bladder control is constipation. It is the secret villain behind so many of these issues. So why? Why is constipation such a big deal here? Well, it's actually kind of mind-blowing. It goes way back to when a baby is developing. The bladder and the rectum come from the exact same original structure. Because of that, they share a lot of the same nerve wiring. So what happens? A full backed-up rectum can literally cause static on the line, jamming the signals the bladder is trying to send to the brain. And what happens is kids get stuck in this awful loop. It starts with constipation. That can lead to a UTI, which makes peeing hurt. So to avoid the pain, the child starts holding it in. But holding it in just leads to more accidents. And the whole thing just goes around and around. Okay, so let's say this is all starting to sound familiar. What happens when you go see a doctor? Let's walk through it so you know exactly what to expect. It's not as scary as you might think. There's this great term from a pediatric urologist, Dr. Barry Bellman, audio urodynamics. Sounds fancy, right? But all it really means is listening. The most important thing a doctor can do is just listen to your story. What you've seen is the most valuable clue. And this is where you become the detective. You can give your doctor so many important clues, like how often are they really going? Do they do that little potty dance where they squat down to hold it in? Doctors even have a name for that, the Vincent curtsy. What does their pee stream sound like? Is it strong or does it kind of start and stop? And the big one, are their poops hard? Every little detail helps. And honestly, here's the best part. For most kids, all your doctor needs is your story and a quick checkup. The vast majority of children will not need any big, scary, invasive tests to get to the bottom of this. All right, so we figured out what's going on. Now for the good stuff. How do we fix it? Let's talk about the path to dry days and nights, because it often starts with some really simple, practical steps. Remember that vicious cycle we talked about? The absolute first step is to break it. And that means you have to treat the constipation first. After that, you can start retraining the bladder. With timed potty breaks, getting a little watch with a timer set for every 2 hours can be a total game changer. And it sounds weird, but you actually want to have them drink more water, especially in the morning, to help the bladder stretch. Keeping a little diary helps track everything too. Now, sometimes the issue gets a little more specific, and it's good to know the difference. If you're hearing that start and stop pee stream, the problem is likely the external sphincter muscle, and something called biofeedback can help them learn to relax it. But if the stream is just always weak and slow, it might be the internal sphincter, and a type of medication can help that open up. And for bedwetting specifically, which I know is a huge one for so many of you, there are some great tips that can really move the needle. Have them use the bathroom twice in the hour before bed. Try to get 2/3 of their daily liquids in before noon. And listen to this. Bedwetting alarms are 80% effective after 3 months. They literally teach the brain to wake up to that full bladder signal. So let's just bring it all home with this one big question. After seeing how the gut and the bladder share the same wiring and how one can mess with the other, could it be that the real key to a dry night isn't just about the bladder at all, but about making sure you have a happy, healthy gut? All the science seems to be pointing right in that direction.